Dr. Jarrod Spencer, author of Mind of the Athlete, joining us here. I'm Dan Moscaritolo, and the second time Dr. Jarrod Spencer has joined us here to discuss athletes and mental health here during the COVID-19 pandemic. Doctor, thank you so much for joining us.
It's always a pleasure.
Yeah. So we've seen the physical toll that COVID-19 has had, but a rise in mental health issues and suicides, they've gone up as well. Are the mental health trends receiving the appropriate amount of attention? We have seen more people, from athletes to celebrities, coming out with their own stories.
Yes and no. The reality is, yes, people all across America, or really around the world, are talking more about their own mental health struggles. So that's a good sign that the stigma is starting to fall. But when you stop and think about it in terms of the bigger picture, I actually think the mental health portion of the epidemic is far greater than even what the news is given attention to. When we do look at media today, what we do see is a common theme that people are suffering, people are hurting really bad. There's a lot of anger. Anger is just really emotional hurt. And there's a lot of hatred being expressed, and hatred really means feeling threatened by. So what we have is a constant barrage of news articles about a lot of hate, a lot of hurt, but really underneath it all, people are suffering and people are hurting. And that's the mental health component that I wish would be labeled just a little bit more, so it might be a little bit more empowering for other people to come forward and seek the help that they really need to help resolve these issues.
What are some of the early warning signs of something like anxiety and depression, and how would you recommend people go about addressing them?
Sure. Well, again, I'm not into psychobabble, so I always try to keep it real simple. Anxiety is fear of the unknown. And when we have a lot of fears of the unknown, like we do right now in the pandemic, anxiety is going to spike. For a lot of people, particularly during this pandemic, I've heard a number of people say, it really starts with a tightness in the chest, that they feel themselves just feeling a tightness here. They also feel like it shows up in insomnia, tossing, turning in the middle of the night. And so that's one way the anxiety kicks in. Now, depression is hurt held inward. When you're holding the emotional hurt in, you're either going to explode, which isn't good, or implode, which isn't good. And so the early signs of depression often starts off with something I refer to as the funk. Somebody's not really depressed, but they're in a little bit of a funk. Maybe they have trouble getting out of bed, low motivation for the day. They just feel lethargic, and they don't really feel quite like themselves. And the negative thinking starts to really do a lot of damage. And this is happening for far more people than you can possibly imagine. So the early signs of depression can often be a little bit more frequency, duration, and intensity of being in that funk.
And in terms of going to help early, what would be some initial steps to really help perhaps quell that before it gets any worse?
Well, sometimes I say the best way is just to go with it. It's okay to feel a little down, depressed, and even in a funk a little bit. And sometimes it's okay to just go with it. Give yourself a little permission for a day or 2 to 3 to kind of go through it. If that doesn't work, then I say you got to start to sweat. And so that you might not have the motivation to get to the gym, but you might say, I've got to go for a walk. And a long introspective walk by yourself is a wonderful way to have the body release some of the feel-good drugs, but also to think through some of that negative junk in your head and begin to work through that and resolve that. But of course, I'm always biased. When we get to that point where we really feel like I should probably talk to somebody, but telehealth is becoming so much more accessible for everybody around the country and around the world. So even though you might not be able to find somebody in your neighborhood or community that you could work with for some counseling, you could do so through telehealth.
So, doctor, if you were to advise someone who's noticing the early signs of anxiety and depression, what would you recommend they do to quell those symptoms before they perhaps got any worse?
Well, when it comes to depression and being in the funk, what I would say is it's okay to go with it. Sometimes we feel like I have to get out of it right away, but it's okay for a day or 2 to 3 to maybe just kind of go with the depression and the funk and try to sit through it. And there's a lot of learning that can occur in that darkness. But if it actually gets a little intense and persists a little long, that's when I'm saying, okay, get up, get out of bed, get outside, go for a walk. a long introspective walk can be really helpful. Your body's going to sweat, which is really important. It's going to release some feel-good chemicals. You're going to get a chance to work through and think through some of those negative thoughts and those reasons why maybe that you're in that funk. But when it gets to that point where you realize, I need help, this is a little bit more than I can manage, absolutely, telehealth is a great new way that people are able to find the counseling that they need. No matter where they're at, they can get that access. That's a great place to start.
As far as athletes go, anxiety right now through the roof, as you mentioned, the fear of the unknown, and what are some ways to thrive in the midst of such uncertainty, and what would you tell parents to help their kids?
Sure. Well, the first part of that question really is about the beautiful part of this pandemic and what it's done for all of us is it's really forced us to stay in the moment. You know, when your mind goes forward, we tend to be more anxious. When our mind goes backward, we tend to be feeling a little bit more depressed. But the only place your mind is really safe is right here, right now, in the present moment. And the pandemic has forced us to stay in the present moment as much as we possibly can, because we don't really know what's going to happen in a week or two from now. Things are so fluid and they're constantly dynamic and changing. So for an athlete, one of the best things is just to appreciate today. If you have a practice today, just go out and enjoy it and give it your very best. Don't worry about tomorrow or the next day. We don't even know if that's guaranteed. So therefore, keep your mind in the moment. And that is where your mind is safest. It's actually a beautiful skill set that they're learning. Now, the second part of your question, when it comes to parents and what should they do, a couple key points here. One is that the parents' emotional reaction to the pandemic and to the athlete's season, or maybe the lack of that season, that emotional piece can't really interfere with the kid's own processing of what's going on. Now, that's important because too often the parents are emotionally enmeshed in what's happening with the kids' seasons. And so now more than ever, we need to kind of begin to tease those apart so that the parent could really emotionally be able to help the kid, not make it worse by their own anxieties or stressors. The second key thing for a parent is really reassurance. The antidote to anxiety is reassurance. Hey, it's going to be okay, no matter what happens. I love you, we got you, and we're going to help you through this. And so the more a parent could reassure, the more it's going to be the antidote to the anxiety that the kid's going to experience.
Now, some athletes have already lost their seasons, unfortunately. And I remember talking to my brother about how we would have felt if our senior seasons were lost, and we both kind of came to the same conclusion: devastating. How would you encourage kids who are dealing with that level of disappointment?
You know, Dan, there's no playbook for this. I mean, we've not seen this before, so this is really unprecedented times. And what I would say to an athlete that may be going through this or might be going through this in the future is that, you know, let it flow and let it go. It's really important to grieve and mourn the loss of a potential season. And the reason why let it flow, let it go is so important is because we don't want this to become an emotional stuck point that 5 years, 10 years, or later on when they're parents to their children, that this hasn't become an emotional stuck point that they've never been able to work through, and it has a significant impact on the rest of their lives. And so that's exactly what we want to present or prevent. And the way we do that is by having the athlete understand that it's okay to cry and to mourn. And this is really where talking about it with a counselor is so vital, because the more you can work it through and find some peace and acceptance, I know that's hard, with a big loss, the more we can move forward in a healthier way.
Yeah, and that really leads to my next point. On the flip side, this kind of adversity can lead to the really development of some positive mental skills. Is this something that you have seen or expect to see happen here down the road?
Well, you know, one great definition of wisdom is healed pain. Wisdom is healed pain. And so when you meet somebody that's really wise, it's always like, well, what kind of darkness did you go through? What did you triumph over? What kind of adversities made you so resilient? And so the beautiful part about this pandemic and the negative impact that's having on everybody, quite frankly, but especially if we're talking about athletes, is that it's forcing them to develop emotional skill sets that maybe they wouldn't have developed otherwise. So as I mentioned, previously about keeping their mind in the moment. That's a wonderful thing. About accessing social support. It's a wonderful thing. It's about the destigmatization of mental health. Again, another positive that's coming from this. And so what's really important is that these individuals, our youth in particular, because they're very malleable right now to concepts, is that I believe this is a generation that is developing emotional skills, resiliency skills that are going to significantly help them along the journey far more than had we not gone through this. Now, I know that nobody wants to go through this, but the healed pain is going to lead them to great wisdom.
And I know when I've gone through, my episode, I really focused on self-improvement, and I think I see what you're saying there. It's almost a blessing in disguise. It's a horrible thing to have to experience, but at the end of the day, you can come out of this as an even stronger and better person on the other side.
Yeah, and like you said, Dan, like when you work on your self-improvement, what's really happens is I'm always encouraging people, get on the path. There's a path over here of self-improvement, and particularly mental health. And sometimes it takes a tough incident in life or maybe a mentor to say, hey, let's get this person on the path. But once you're on the path, you realize there's a lot of podcasts. There's a lot of great YouTube videos. There's a lot of wonderful teachers and preachers and counselors on that path. And as soon as I get on the path, I realize, oh my goodness, I'm going to be okay because there's help and there's hope. And so I would say to anybody right now, that self-improvement is key by getting on the path. And once you're on the path, you're going to go in a totally different direction, and you're going to develop resiliency along the way.
And lastly, can you see, once the pandemic is cleared, more of a focus being put on mental health, not just for athletes, but for anyone really who's had to go through this?
Dan, I really wish I could say to you that we would. And I think that my response is going to be partly, I think from the ground up, from the people up, we're going to start seeing, yes, the destigmatization has really continued. But truthfully, in any situation in life, if you really want to find if it's really kind of changing, you got to follow the money. And if I'm being very frank with everyone, if you look at the funding for mental health in our schools districts, in our colleges and universities, particularly when we talk about sports psychology and working with athletes where athletics are so emotional, what we see is that the funding's still not there. And of course, across the board in America, funding for mental health is still really lacking. And when we begin to see a lot of money flowing in the direction of services for mental health resources put into the hands of our students in particular, then I believe that we're really going to see the change that needs to occur. And so my hope is that not just a destigmatization, but also systematic funding of it that makes it mental health system far more accessible for a lot of those people in need.
All right, great stuff. As always, that's Dr. Jarrod Spencer, author of Mind of the Athlete, a friend of the program for sure, always offers great insight. Doctor, thank you so much. Very illuminating stuff, and I think really important for anyone out there who's struggling right now.
Hope it was a help. Thanks so much.